Good afternoon, everybody. This is Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. Today is June 26, 2020. Happy Friday. And this comes from the Falmouth Health Department. For information, you can visit the mass.gov COVID website. We also have links on the www.falmouthmass.us, which is the town's homepage. Emails can come to the Health Department at health@falmouthma.gov. And our phone number at the Health Department is 508-495-7485. There is a lot of emails and calls that come in. We'll do our best to get back to you as soon as possible. So here we go. Since March 1st, we've had 201 cases, which is about a 5 or 6 increase over last week. Over 93% of all total number of cases are no longer under isolation. About 96% of all non-long-term care, so if you took out the long-term care cases, we're about 96% out of isolation. So most of the cases obviously are in the past, and we'll go over that. Falmouth is approximately around 13% of all cases in Barnstable, which has been pretty stagnant over the last month or so. We expect to be around 14% because we're about 14% of the population. And with our highest being in early April at the beginning, late March, early April, we're around 23%. And of course, the health department with the VNA are still doing contact tracing and doing the isolation and quarantine as needed. Looking at Falmouth's weekly cases, you can see that since about late May, we've been averaging definitely under 10 per week, with it being somewhere around 5 or less for the most part. We've had a couple upticks in long-term care. That's where our 20 cases were in early May. Late April, we're around that 10 to 15, and when we first started, the event first happened, when COVID first started coming around, we were really hot and heavy at the beginning. But we're doing well now, and our average number of cases remains around 5 per week. Since the beginning of the outbreak, we're right at 200. We've definitely had an increase, you can see in early April. A little bit of an increase in mid-May. That was due to long-term care facilities here, and we've had a leveling off since then. For those who may not know, that every day, mass.gov, DPH has a COVID dashboard that is updated daily around 4 o'clock. This is the ones from yesterday. Total cases is 226. That is considered with antibody tests, which show you a previous infection, and also the nasal swabs, which tell you a active infection. So no reported deaths for the day were 25. Total cases are 107,000, with over 1 million now molecular tests alone administered. Looking at our status for we remain with the with the green positive trends, the COVID-19 positive rate, the number of patients in hospitals, and we'll go over these trends in a second, and testing capacity all remain positive. In progress are deaths, healthcare system readiness, and contact tracing capabilities. I think we need another 1,000 or so contact traces for that to turn into a positive trend. But the ones that, and we'll go over each one of these in detail. Molecular tests are the nasal swabs that show you the active infection. That's the number we've been using because that's the number we kind of had from the beginning when the COVID dashboard started. We've been averaging around less than 200, between 150 and 200 daily cases, which is quite low when the population is about 6.9 million. Deaths, there's always a delay to deaths because some people are on the vent for a while and it may take several weeks. Our deaths were 24, but that trend remains pretty good. Total confirmed cases just under 103,000, with deaths it's 7,776 confirmed. The trends, this is an important slide here. You can see that in previous ones I tell you to keep an eye on the positive test rate, which you want to have under 3%. You can see since mid-June, on June 12th, we hit below 3%. We've remained in a downward trend, which is great. So if we can keep the number well below 3% and keep on that trend, that means we're doing well. Number of patients in hospital continues to go down. As you can see, it's a downward trend. Surge capacity is sort of flat at that 2 to 4 range, comes bouncing around there. That's going to be regional and depend on, in particular, maybe a hot spot going up and so forth, or perhaps a town that has a small hospital that needs to do surge capacity. But that's been remaining relatively stable. Definitely a lot less than the beginning. You can see an 81% drop. Deaths continue to go down, though slowly. It does come down, as you can see in the chart there. By county, actually, I think yesterday was the first day from Wednesday into Thursday's dashboard, there was 0 cases in Barnstable. That 1525 remained the same in the county. That's the county numbers. You can see we've been pretty flat line. You can see from the light blue line with the arrow pointing at it has been flat for some time, which is great, and that's where we are there. So it's been flat, pretty much flat everywhere, and hopefully that trend continues. This is to show the number of cases, the number of released from isolation and deaths that currently about 3.5% of the confirmed cases since the beginning are not out of isolation, they're still isolated. So what this chart tells you is most of the people have already had it and gotten over with it, or unfortunately didn't get over it and passed away. But most of the event currently was in the past, and there's currently 3,606 people in the state currently still under isolation and have not been cleared. And that's as of June 24th. Falmouth, compared to the rest of the state in terms of infection rate, our rate is about 643 people per 100,000. The state's rate is 1,475 per 100,000, or 1.4%. So we're about 2.3 times lower than the state average, and that's been pretty consistent since probably at least a month, 6 weeks ago. Percent positivity based on testing is 5.74 from the beginning. Our testing rate is slightly under what the state rate is, but not far off at about 11,300 is about the average per 100,000 as far as people getting the test. Hospitalizations are down 146 from the last time I did this. I do this presentation every Friday, as you know. So June 18th, the data I pick up the day before. So we have down 146 from last week doing this presentation, which is good. And our current hospitalization's under 1,000, and that's great to see. And hopefully that trend is, of course, it's been like that for a while. Our current cases in the ICU, this is statewide, this is 174, is down 53 from a week ago. And current cases intubated, that's people that are on the vent, are down 125 from June 18th. So our numbers are down and showing the trend that we're looking for. Long-term care, as you know, is always an issue. It's been an issue, been a big issue in this whole thing. 63% is a relatively consistent number of the total number, in this state anyway, the total number of deaths associated to long-term care facilities, 63% of all deaths. You can see that JML has had, there's been some COVID deaths at JML and Royal, and there's obviously cases and some deaths. Those have flattened out. Haven't seen any activity on those in the last week or so, which is great. Hopefully it doesn't get any more cases, any more deaths, and so forth at the nursing homes here in Falmouth, the long-term care facilities. Hospitalizations, Barnstable County it produces this chart once a week, and it shows that the hospitalization rate at both Cape Cod Hospital and Falmouth Hospital are relatively consistent. We're at 5.0 last week, 6.3, 6 in the hospital, 6 in ICU, 3 in the ICU, 6 in the hospital. And these are also mostly suspect and confirmed, so some would come off if they tested negative, for example. But that number, that trend has been, since early June, we've been averaging around that 5 or 6 in the hospital with 1 to 3 in the ICU. So that's where we've been at that. So it's been relatively consistent. But as far as testing, Cape Cod Healthcare is still doing the testing at the community college at 4Cs, set up as a drive-through. It is going to be transitioning, I've been told, to Cape Cod Hospital, with hours Monday through Saturday as of now, still at Cape 4Cs, from 9 to 5 from Monday to Saturday. Your physician will still determine the need for a test and will schedule with the testing center so it's by appointment through your physician. As of June 24th, Falmouth Hospital set up a drive-through. So there's sort of getting rid of the 4Cs and going to the 2 hospitals now that there's a lowering of demand, lowering of cases. But you still have to go through your physician's approval and that process that was happening at 4Cs. Also available at some pharmacies. I've heard that the East Falmouth CVS, some walk-in clinics like our Convenient Care also does it. And some may be doing that without a doctor's note, and so that's your other option. You can visit mass.gov COVID testing and Google that, And that website will tell you all the test sites that are out there in Massachusetts. So it still need a doctor's approval for the Cape Cod Healthcare 2 testing sites. Others may not. I don't believe CVS does, but you can call them ahead of time. I do believe they do require an appointment, and so you can get a test. Definitely if you're having symptoms, you want to be tested. You want to isolate yourself out away from others, and pending your results. And the results usually do take a couple of days to get. So if you do need a test, also you can also call or email the health department, but it's quicker just to cut to the chase and do it this way. Reopening, of course, if you don't know, starting in June 8th, we went to phase 2, which allowed outdoor restaurant seating. We have seen that around town. Restricted retail, lodging and short-term rentals opening, rec camps, sports fields, some outdoor practices, semi-public and public outdoor pools. There's all kinds of guidance on all of it. If you're interested, some is very ominous, especially like rec camps. I think it's 33 pages. All is based on social distancing. And then as of the beginning of this week, starting June 22nd, step 2 of phase 2 went into play, which allowed indoor restaurant seating with 6 feet of space in between parties. With other guidance, there's some spacing barriers. You might, if they can't get 6 feet, if you had a wall in between, obviously that would be okay. So there are some guidance for that. Personal care locations such as nail salons, personal trainers, massage therapy, tattoo salons are allowed to open with guidance. Office spaces, what used to be 25%, have been allowed to increase to 50%, with still the caveat of please work from home whenever possible. Fitting rooms are okay by appointment. That was the main phase 2, step 2. And I believe there's 3 weeks in between since it's June 8th, so I think around the 29th, so next week, there could be conceivably the earliest with phase 3, which we would cover. The governor hasn't really given us any information whether he's thinking of going to phase 3 that soon or maybe waiting. I'm not quite sure. Phase 3 has got a lot of other things that could be opening up. So as a recap, the state metrics are continue on the good trajectory, and Falmouth cases and the Cape cases are low. We are under phase 2, step 2. And of course, keep up the fight and maintain good social distancing with spacing and face coverings. Social distancing is going to be with us for a while. It seems to be very effective, the masks and the social distancing. The health department do receive 20 to 50 complaints per day, and we do the best we can to manage them. But obviously, keeping up the social distancing is key to allowing these phases to open up so that we can get to some sense of normalcy until we get some sort of conclusion to this. So that's what I have for this week, and I'll see everybody next week. Thanks.